course, we are honored to have with us here, even at short notice, the Coordinating Minister of Health and Social Welfare, Dr. Mohammed Ali PATE. It's a delight to have you join us here on the program, sir.
Thank you.
Excellent. So I just want to take you quickly on this concern around public health. Of course, as it stands right now, it will appear the biggest conversation is around diphtheria. We've seen Ebola, we've seen COVID, and a couple of them in between. And right in the middle of it, we're still dealing with the SDGs. So walk us quickly through what government, under your leadership in particular, is doing around that.
So the entire population of this country is a client of the health sector. There are those who are sick, and there are those who are sick, they don't know it yet, and there are those who are healthy that we need to preserve and protect their health for as long as possible. That's why we put a 4-point agenda on the path to Nigeria reaching universal health coverage and consistent with Mr. President's renewed hope agenda to focus on improving the overall governance of health, because health requires the federal government to work with the state governments. It requires to engage communities and citizens, the private sector, civil society, media, all of us to build consensus that health is important, to make progress in terms of setting priorities, but also executing on those priorities, tracking our progress, responding to our needs of the citizens, and ensuring strong regulation that are appropriate. That's one pillar. The second pillar is to improve population health outcomes by working at the primary healthcare level, working with the state governments on their secondary facilities, and improving the state of the tertiary facilities in Nigeria for those who are sick. That requires operationalizing the National Health Act, and the basic healthcare provision is a good basis for that. 1% of the federation revenue is actually accruing to the basic healthcare provision.
Exclusively?
Fund. Yes, on basic healthcare provision. And that goes through Primary Healthcare Development Agency and the NHIS to go and work with the states, providing counterpart funding to rejuvenate the primary healthcare facilities. We have almost 8,000 primary healthcare centers receiving now direct facility financing. We need to improve that. We need to ensure that the health workers are there, they are trained, they are equipped, the commodities are there, and on the demand side to ensure that the affordability, particularly for the most vulnerable population, is enhanced. And for NHIS overall, the National Health Insurance Authority, which has just launched its operational guidelines for 2022-23, is to ensure that, in fact, the roles and responsibilities are clarified, and that it's a regulator and promoter of the integration of the health insurance system, so that more and more Nigerians will be covered by health insurance, to reduce the challenge of out-of-pocket payments, to improve the affordability of healthcare, the quality of what that healthcare is for our population. In addition, the third pillar is to optimize on the healthcare value chain, to pursue medical industrialization as an agenda, so that we produce more of the generic pharmaceuticals that we need in our country. At the moment, we produce less than 30% of the generic pharmaceutical consumed in Nigeria. We're a large country. We can begin to do that by strengthening our industry, strengthening our regulatory framework, and attracting the investments domestically, externally, as a matter of policy priority, to ensure that more and more of those products that we use of the level of efficacy, safety, and are affordable to our population. And that's very important. It will create jobs. It will also retain the economic value within our country as well. The fourth bit is on the public health agenda. We saw with COVID how public health issue, COVID-19, undermined economic progress, not only in our country, but globally. Every country was affected. So how do we ensure that we have good surveillance systems? We detect outbreaks when they occur, diagnose them as quickly as possible, and control them as quickly as possible. With the NCDC, we are going to work with it very closely as the federal ministry, because it's part of the ministry, and the states, to train the epidemiologists, to strengthen the laboratory systems, to ensure the surveillance systems work, and that there is quick communication and coordination, not only within Nigeria, but within the sub-region, as well as outside. So that things like genomic surveillance, so that when pathogens, when new diseases come out, we know what they are very quickly.
Tackle them early enough.
Whether it's diphtheria, whether it's cholera, whether it's Lassa, whatever pathogen comes, we should be able as a country, as a matter of our own national security, actually be able to get a handle on it and get the support of some of our partners like the World Health Organization and others and Africa Center for Disease Control to really tamp it here and also protect our borders from getting diseases that can come to us.
I know you're pressed for time, but for 1 minute, I mean, just within 1 minute, we've seen so much of this so-called jackpot trend happen recently, and the medical community has, I mean, seems to have had a little more than its fair share. We've seen doctors leave this country in droves. What are we doing to be able to fill up that deficit, if you like?
Yes. Well, Nigeria is very blessed with a large population, youthful population, very well-educated population. And the fact that people are attracted to recruit them, I don't think is necessarily a bad thing, but we need to produce more. So we're going to shift our efforts working with our colleagues in the education sector, but also it's not only the federal government. States have to expand the training so that we train more. And for those that are here, to provide them the enablement. Because health is a profession whereby intrinsic motivation drives it. Nobody goes into healthcare profession, whether doctor, nurse, pharmacist, or technologist, who doesn't want to serve others. So to tap into that, and I have to say that the incessant strikes and conflicts in the health sector, we're beginning to see a path where they are going to reduce, because all of us health professionals as a team are realizing that, look, we have to come together and put the patient at the center and organize ourselves and work together to ensure that we stabilize it. And so the need for health workers to JAPA will be increasingly reduced, and hopefully those that have even JAPA'd will come back. Yesterday I received a call from one of the organizations of Nigerians in diaspora. Thousands of our health professionals are beginning to look at how can they be able to come back home and contribute. Some of us, the Honorable Minister of State, myself, had trained abroad, but we're very pleased and very honored that the President invited us to come and contribute in changing this country's health system for the better.
It's a great pleasure talking with you. Thank you for taking out the time and honoring us with this expertise you've shared with us today. We've been talking with the Honorable Coordinating Minister for Health and Social Welfare, Dr. Ali Mohammed PATE. And that's it on the program. Thank you for watching. I'm Uyi Agbomofuegbe. Thank you.